Hi, my name is Dr. Filetta, Assistant Principal at Southern Regional High School, and I'm here with Mr. Zatorsky from the Southern Regional Middle School. Our goal today is to talk to you about our contact tracing process and what that's going to look like for the district. First, the members of the high school contact tracing team will consist of myself, our nurses, Mrs. Bates and Mrs. Noakes, members of the administrative team, and also our guidance department and child study team.
In the middle school, we'll have the nurse, Mrs. Klimkowitz, the administrative team, members of guidance, and child study team.
So we're going to go through the process in which how contact tracing will work. So when we are alerted of a positive case here at the district, we will then be notifying all members of the district, all stakeholders will receive a global notification similar to what we do with a school closing or something like that. So that information will be sent out and the contact tracing process will then begin. We'll then determine where the positive case is. We'll begin to do a cohort analysis to look at their schedule and also interview the positive case to determine the close contacts.
A close contact for COVID-19 is any individual who was within 6 feet of an infected person for at least 10 minutes, starting from 2 days before the illness onset, or for asymptomatic patients, 2 days prior to the positive specimen collection, until the time the patient is isolated.
So based on that, we'll then begin to streamline who is a close contact and who is a possible close contact. So a second message will then go out to all possible close contacts. And then we will, at that point, we'll continue to further to narrow down who are the actual close contacts. And from there, the actual close contacts will receive a personal phone call from your child's guidance counselor or child study team member, depending on the school, to provide more information for that student.
Close contacts with symptoms should immediately self-isolate and be referred to his or her personal physician for further medical advice. Close contacts with no symptoms will be asked to self-quarantine for 14 days from his or her last potential exposure as determined by the contact tracer. If symptoms develop, close contacts should immediately contact his or her healthcare provider.
As a close contact, you'll be asked to quarantine and have your child quarantine. So students will continue to have access to their Google Classroom to maintain their academic work. If you have any questions regarding that, please feel free to contact your guidance counselor. Also, the district will maintain communication with all close contacts during the quarantine to determine if there are any changes are necessary. A date of return will be provided, and unless symptoms develop, students will be permitted to return to school on that date. And again, that will be a 14-day period.
If you have any questions or concerns, please feel free to contact the appropriate school with any questions. In the high school, you'll contact Dr. Richard Filetta. In the middle school, you'll contact me, Brian Zatorsky.
Thank you.
Thanks.